Pleasant good afternoon to everyone. This afternoon, as per usual, I'll share with you the Health Emergency Operating Center Committee Situation Report for today, Wednesday, May 5th. To date, the Federation of St. Kitts and Nevis would have reported a total of 45 confirmed cases of COVID-19. Ladies and gentlemen, 44 of these cases have fully recovered, and so at present we are following or monitoring one active case who remains stable. And please note that this case again was imported, an imported case of COVID-19. And the individual is in quarantine as we speak. The individual would have left the airport and went straight into quarantine and was subsequently identified as a case of COVID-19. Now, based on the World Health Organization's COVID-19 dashboard, between last year, January to present, as many as 153.7 million persons have been affected and diagnosed with COVID-19. Over 3.2 million persons have died from this condition. And concurrently, many territories or countries globally have rolled out their COVID-19 vaccination programs, and to date, over 1.1 billion doses of various types of COVID-19 vaccines have been administered. In the United States of America, 32.5 million confirmed cases have been reported, and over 578,000 deaths have occurred because of COVID-19. And the numbers continue to rise in the United States of America, and it's of interest that we look at the news coverage of what's happening in India, where we see a tremendous surge in the number of cases, the number of newly confirmed cases every day, and the total number of deaths in India. In terms of vaccination, COVID-19 vaccination, as I said before, over 1.1 billion vaccine doses have been administered worldwide. And so this slide highlights the countries, some of the countries and their success rate in terms of COVID-19 vaccination. And so based on the New York Times dashboard in terms of worldwide COVID-19 vaccination, Seychelles is one of the leading countries in terms of being successful in vaccinating its population. 61% of the population there is fully vaccinated. Israel is also doing very well with 56% of its population fully vaccinated, meaning persons would have received 2 doses. In the United States of America, they have a coverage of 45% of persons receiving 1 dose and a coverage of 32% in terms of its population being fully vaccinated. In the United Kingdom, 23% of the population is fully vaccinated. Canada, 3.1%. Please note that the United States and the United Kingdom would have commenced or started on this journey from as early as December 2020. In the Caribbean region, again, we realize that the pandemic is worsening. And then the next slide provides data, specific data regarding the Organization of Eastern Caribbean States. Okay, so in the OECS territories, the 9 territories collectively, as many as 12,063 persons would have been diagnosed with COVID-19, and as many as 163 deaths have been reported secondary to COVID-19. Interestingly, today is exactly 2 weeks since Anguilla, the health professionals in Angola would have identified a cluster of COVID-19 cases. And so within 2 weeks, we see the number of confirmed cases in Angola jumping from 29 to 95 in just 2 weeks. And we also see the vaccination, the successes in terms of vaccination programs in the islands. So in Dominica, they would have achieved a coverage rate of 13% of its population being fully vaccinated. Grenada, 2.4% of its population being fully vaccinated. And then in terms of the first dose, we could see what's happening in Barbados, 26% coverage, Montserrat 22%, St. Lucia 13%, St. Vincent and the Grenadines 13% in terms of the administration of the first dose of the vaccine. In St. Kitts and Nevis, the slide that you're looking at shows the data as at yesterday, the end of day, work day yesterday, in terms of the number of vaccine doses administered. But let me just back up. Now, Monday made 10 weeks, exactly 10 weeks since we would have launched our national COVID-19 vaccination plan. And so yesterday, we officially started the drive in terms of the administration of the second doses of the AstraZeneca Oxford vaccine. And so as at end of workday today, Wednesday, May 5th, 13,000 over 13,000 vaccine doses have been administered, or as many as, 39.5% of the target population has been covered with the first dose of the AstraZeneca Oxford vaccine. And then, up to today, over 220 persons would have received their second shot or second dose of this vaccine, or a coverage of 0.7% of the target population. We continue our surveillance, COVID-19 surveillance. So in other words, anybody who presents at the emergency room, JNF or Alexandra Hospital, exhibiting COVID-like symptoms, they are evaluated, they are tested. And so we continue testing and monitoring such individuals. So to date, over 13,000 persons would have been tested with a mere positivity rate of 0.3%. This slide shows that we have 44 cases recovered, one in isolation. I want us to pause here to highlight the fact that today, 2 charter flights would have landed with yet another batch of students for the Ross University School of Veterinary Medicine. And so a total of 105 students would have landed today, and they would have left the RLB International Airport en route for the dorms on campus, where they will be in quarantine for a total of 14 days. They will be tested upon arrival. They were tested prior to coming to the Federation. They are going to be tested on arrival as per usual, and then they will be tested at the end of their quarantine period. And so today, again, we continue to update the public regarding our Oxford AstraZeneca vaccine and our COVID-19 vaccination plan, just to underscore that once you are fully vaccinated with this vaccine, you would enjoy an 83% risk reduction in the ability in your ability to pick up COVID-19. So very, very few persons who are fully vaccinated do contract the disease. They call them breakthrough infections. And what the literature suggests is that this would only happen to individuals under 2 main circumstances. One, if you are in contact or interacting with individuals who are positive. So in other words, if you're in a setting where there is an outbreak or clusters of cases, then you run the risk of a breakthrough infection. Or if perchance you are fully vaccinated, but you are not adhering to the COVID-19 prevention measures. So in other words, you're not wearing your face mask, and if you falter in terms of your hand hygiene, and if you are too close to strangers in public spaces, then the risk of a breakthrough infection will occur. So in other words, once you're fully vaccinated, the risk of you picking up COVID is quite slim. And so it also, highlights the need to continue the COVID-19 prevention practices that we've been advocating all these months. We are providing this vaccine to adults, persons over 18 years. Next. And so this slide just summarizes the post-vaccine symptoms. Tenderness at the injection site, feeling cold, mild fever, relieved by paracetamol. And so with respect to the over 13,000 persons who have received this vaccine locally, just minimal side effects. So there is a fairly good side effect profile related to this virus. And this is based on our local experience in the Federation. All right, so just again to reiterate the benefits of this vaccine, it's approved by the World Health Organization, it's effective. As I said before, it provides you good protection in terms of a reduction in risk in terms of picking up the disease. It prevents you from severe illness and hospitalization and death. And based on the studies, the data coming out of the trials, this vaccine works quite well in older adults, persons who are 60 years and over. So it's quite safe and effective when it's administered to older adults. Next. It provides some protection against the variants of concern. So, ladies and gentlemen, there are quite a few SARS-CoV-2 variants of concern that are emerging. So we know of the variant identified in the UK, South Africa, Brazil, and then just over the past few days, we are learning about the double mutant variant that has been identified in India. And work has to be done with respect to this new variant, but based on the information we have, the AstraZeneca Oxford vaccine provides some level of protection against most of the variants of concern. This vaccine also is associated with a reduction in risk of transmitting the virus. So there's a reduced risk of picking up the virus, and there's also a reduced risk of transmitting the virus if you do pick it up. And again, this vaccine has had a very extensive global reach, with well over 142 countries globally utilizing this vaccine in terms of their domestic COVID-19 vaccine rollout plans. Now, last week, Tuesday, the Honorable Prime Minister, Dr. Timothy Harris, would have announced some policy changes in terms of our health and travel protocols in the first instance, and along with some other changes. And I'll just give a quick summary. And so one, there is a reduction, inbound passengers who are deemed fully vaccinated, meaning if they would have received either of these four COVID-19 vaccines, that's the Pfizer-BioNTech, the Moderna, the AstraZeneca Oxford vaccine, and of course Johnson & Johnson. So if an inbound passenger is deemed fully vaccinated coming into our country, they can enjoy a reduction in their quarantine period, reduced from 14 days to 9 days. Please note the definition of being fully vaccinated means that you would have received the full dosing regime of the vaccine that you would have taken, and then 2 weeks would have elapsed between the last dose of the vaccine, and your date of travel. Ladies and gentlemen, the COVID-19 pandemic disrupted school in the Federation of St. Kitts and Nevis in 2020, and some of this disruption continues even to present. For example, the Washington Archibald High School and the Bastia High School, there is still a shift system or program in place at these two high schools whereby students are assigned to morning shift or afternoon shift. And this really means a shortened time in which to cover the curriculum. So in other words, our students have lost significant time in terms of covering their academic curriculum. And some students are struggling with learning during these challenging times. And so it's with this backdrop, ladies and gentlemen, I'm encouraging our adults in our population. I am encouraging, or we are encouraging the parents in our population, we are encouraging the adults in our population to come on board and accept the COVID-19 vaccine, because in doing so, you are really helping us to keep our children in the classroom. This is very, very important, because if the adults come on board and accept the vaccine, and we are able to achieve the herd immunity threshold of 70%, then if perchance there are clusters of cases or community transmission, the risk of spread of the virus would be much reduced, and then we may not have to close schools down. We may not have to revert to virtual or remote learning. And so, ladies and gentlemen, indirectly, if you come on board and accept the vaccine, you will be helping to keep your children, our children, in the classroom. The fully vaccinated persons, you still have to go online, the KNA travel form, you still have to submit a negative RT-PCR test done 3 days prior to travel. And then, as I said, your quarantine period will be reduced from 14 to 9 days. Effective May 20, again, fully vaccinated spectators will be able to access venues of amateur and recreational sporting events. So, for example, football match, basketball, athletic meets. However, the following requirements must be adhered to. One, the spectators must maintain hand hygiene, especially at entrance to the sporting event. You must wear your face mask, and then the event organizers will be asked to adhere to the 50% spectator capacity and maintain a registry of names and contact information of all the fully vaccinated spectators who would be admitted to the venues. And of course, we'll expect that temperature checks will be done on entrance. Please note that the organizers of these fully vaccinated sporting events must first seek approval from the Ministry of Sports and the Commissioner of Police. Next. Again, the PM, Honorable Prime Minister, would have announced that there is an opportunity for organizers of fully vaccinated cultural and entertainment events to target fully vaccinated patrons, and the start date for this is July 19th. Again, patrons, the fully vaccinated patrons must maintain hand hygiene, temperature checks on entrance. Patrons would be asked to wear their face mask, and we expect that there would be a registry of names and the contact information of patrons at the entrance, and the organizers would be asked to adhere to the 50% patron capacity. Again, such events the organizers must seek approval. This is just to bring to the public's attention that there is a travel advisory for travelers from Brazil, UK, South Africa, and India. These are the territories where the public health specialists would have identified SARS-CoV-2 variants of public health concern. And so it's with this backdrop that we are asking tourists who are intending to travel from these aforementioned destinations to you are advised not to travel to the Federation at this time. However, our citizens and legal residents who are returning from these countries, you will not be denied entry. However, you must go on the URL I highlighted on the slide, www.knatravelform.kn, and complete the entry form and provide us with all the documents, the required documents. However, upon arrival, you will obviously have to provide us with a negative RT-PCR test done within 3 days of travel, and then you'll be screened on arrival, and then you will only be allowed to quarantine. This is strict quarantine for 14 days. Ladies and gentlemen, protect yourself. Let us protect ourselves from COVID-19 by accepting the vaccine. #vaccines work. #do not wait. Vaccinate. Very important. Let me underscore. Do not wait. Vaccinate. At present, we have a number of vaccine doses available to the population, but the shelf life of these vaccines limited. In other words, we must utilize the present stock of vaccines that we do have by, on or before the end of June. So do not run out of time. Do not wait. Vaccinate. Thank you.